any public participation
When we
today.
call, we call to order at 6:30. Sure.
So is that you?
Yeah, yes, do you want to start public comment?
Yep.
Julie, you can unmute for public comment.
Good evening, can you hear me?
And it's Dolby over here.
Oh, good, you can hear me, good. Julie Scott for Central Street Wakefield. Thank you so much for meeting tonight. I read your agenda and I wanted to just touch on a couple of things. I will be less than 3 minutes. As far as the marijuana overlay district, whatever you decide to do tonight, I would appreciate, because you had mentioned communication amongst boards is one of your agenda items. It would be really helpful if when you guys decide how you'll be approaching this issue at town meeting, if you could also reach out to every single town board, all of their emails are on the town council of the town hall website. With your intentions on how you feel about this marijuana overlay district, I'd appreciate it. And I know the entire community would appreciate it. And it would begin to put that cycle of communication in order, with which is what you've been seeking as well. If you could email your stance also to the entire membership of the Wake Up organization. I sent it all to my phone. If you click on it and copy it, their emails actually are right next to it on the website of the Wake Up group. If you could also email the school committee, and any committee you could actually think of, that would be great. Police and fire also. If you later in the meeting could let me know if you've reached out to the police chief, perhaps he'd like to do some sort of a presentation. As far as communication between boards, I reached out about the overlay articles to you, and I appreciated that you went to the planning board and followed through with things like that, but it is important. I wish that the town council reached out to you and it didn't have to be me. And if I hadn't, you may not have known that this issue was coming up. So I do think if somehow you could reach out to the town council, that might mean that when people have issues such as that affect you and they are going to go on the town meeting warrant, perhaps the town council will require that potential warrant articles will have to be brought through the planning board process a week or two earlier than they are currently allowing, because everything is timed to a calendar. It's on your agenda also, you have the food service reporting. There's a food store that got myself and the rest of my family through the pandemic in Wakefield. I absolutely love it. They had an issue with you guys about 1.5 years ago. They took the opportunity when they were closed to advertise on Facebook that they were deliberately redoing their refrigeration and stuff. And I didn't like that, because I really did know what was going on. I think it's important that the community is told what's going on. I still love this business. I still go to this business, and I saw a side of that business that I didn't like, and I still chose to go back to them. But if you had told us, maybe they wouldn't have made up a fancy scheme to have gotten a whole new refrigeration, bunch of units put into their store. I also would like to know about food service industry, restaurants and things like that. I would like to thank the chair for her service to Wakefield. And at some point tonight, if you could sort of let me know, I'm kind of interested about if there would be any future spa public hearings. I know there was one that was to be continued. I don't know the status of that. So thank you very much for all you do for Wakefield, and I'll be watching your meeting. Thank you.
Thank you. Did we all get that?
Yep.
That's a lot.
Yep,
Okay. So we're not gonna respond. We'll respond into the, as we actually get the agenda to make it a little bit organized, but thank you for that. Do I have a motion on the minutes?
I make a motion to accept the minutes.
I'll second the motion to accept the minutes.
All in favor?
Linehan, aye.
Silver, aye.
Corville, aye. And it's approved. We'll close public, it's not here. But yes, we're closing public participation as
There's no
well.
one else.
Oh, that's right. Okay, so done. Okay, so dovetailing nicely with what Ms. Scott just shared, I just wanted, Catherine is also on with us from Wake Up. I believe we'll be talking about this at Wake Up as well, but I just wanted to figure out, well, first of all, just do a quick timeline that there is on the warrant. So our moratorium ended automatically.
Correct, that's 2018.
So years and years ago, back in the day, Chief Smith was from police, was very invested in, you know, preempting legal, understanding that legal marijuana was coming to Massachusetts and preempting a moratorium for Wakefield. And that moratorium has done its time, and planning board was approached to consider an overlay district for marijuana. It turns out that it's, you know, it's a small shop, it's not industry, it's over on Audubon, I've driven by it. In our last meeting, we did note that it is close to daycare, it's right across the street from a housing complex that, you know, often reflects citizens who would fit into sort of the disparities of healthcare, vulnerable population, thank you very much. And so it occurred to me that we as a board, I will be a public citizen at the time, might just want to address the town after planning. So I was not able to get to the final planning board, but the planning board did agree to push it forward. And so it will be presented at town meeting. I can't remember which warrant it is.
It's
but
down there.
Yeah, so it's probably not gonna be the first night.
No, I wouldn't.
But, you know, I think it's appropriate to educate the town on the history that we have done in this regard and kind of list pros and cons. One of the things that I would dispute after speaking with Catherine and Anthony is that there is this assumption that there's a community impact fund, which we're knowing is not really happening in reality of the marijuana establishments that are happening in Massachusetts. And to Julie Scott's point, you know, really appreciate, you know, citizen doing this much work. You know, that the Cannabis Commission is in array, disarray. So I didn't know how we might consider presenting. Catherine, I didn't know if you had any more history to add to that, or your thoughts about that coming from Wake Up, and also what the difference is on what we can say now that we couldn't say then, because then we were under the ruling of a federal grant. You have to be super careful to maintain a neutral stance, and I don't know that we have to be neutral. However, being neutral may very well be a more impactful way to approach it. So what do you think, Catherine? What are your thoughts? Oh, we can't. Is she not? Wait, mute. Didn't say she's muted.
Yeah.
Oh, maybe that's
She
why.
didn't have her head.
No, is she muted on our side?
No, I don't see it.
Huh. That's odd.
The only person who is this is Julie. Julie's muted.
Yeah.
Might be something.
It doesn't say that you're muted on your name tag. Oh, no.
Maybe unplug your headphones, plug them back in.
Unplug, plug back in.
Yeah. Or she might have something on her headphone that's muted.
Do you want to not use your headphones and unplug them all together? How about that? Now you're muted. No, you're not. Oh, no.
Oh, volume, is your volume?
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 Do you have volume? Do we have volume?
She might have one wherever she is.
She can hear us, I can tell she can.
Yeah,
Yeah,
you
she can hear us.
Yeah. Oh, shoot.
Can she write?
Hold
up papers.
You can do an attachment. You can share a screen.
Maybe she can call.
Or she's gonna call.
Use like phone audio.
Yeah.
Maybe while she's sorting
Yeah,
that
go ahead.
question,
Yeah.
because this was before me. Am I understanding this right? At the time, Wakefield voted not to have, like, if given the choice, Wakefield would have voted against having any of these places in town, right?
Right.
And that was that on the warrant, or how did that vote happen? Was that on the ballot? Was it?
It was Warren.
It was a warrant,
It was
and at the
town
town, at that time, the town voted against having any of these places, and then that's what kind of gave them that time to sort of, nobody could build here, because the
Right.
town at the time had said
Right,
no.
had
right,
moratorium,
Okay,
right,
so,
right.
and that was in 2018,
It
That's
ended in-
13?
Ended in 2018.
but that was vote when the town.
13.
So it
13.
corresponded with the legalization. We
Okay.
were preempting the legalization.
So 10 years ago, the people of Wakefield elected not to have those kind of establishments in this town.
That's correct.
Okay.
Yep, right. Yeah, so we have it, you know, and, you know, as an aside, Catherine might remember this. Okay, there we go on your phone. How about now? Ah,
Can you talk?
not saying anything.
She's walking.
She's walking away from her.
I'm walking away.
All right, I
I can
gotcha.
hear you.
Can you hear me?
Yes, we can.
Okay. Yeah, it was on the ballot initiative. It was on the warrant. And we along with several other communities across this state have a ban in place. So this is what the planning board is proposing would create the overlay district.
Were we notified that warrant was expiring? We were
Uh,
never notified, right?
No,
Did they have to notify us though?
I thought they had to publicize it at least, right? Or redo it,
From
or?
what I understand, the way it's written, it was passed, the moratorium was passed in 2017, ending in 2018. So they'd specify what day it would end when they first passed it,
so
so.
we missed that.
We sort of knew it was coming, but we didn't know.
Yeah,
I think that was when they were both starting to really
yeah,
grab up
yeah,
to
yeah.
make the legalization. So a lot of places kind of sat back.
That's
waiting
true,
to
that's
see,
right. There were a lot of
remember?
towns kind of, yeah, so it kind of just gave people some time. But I don't know the legality and we can
And-
certainly pose that at town meeting.
Could another establishment, could they build more than one establishment in this district?
So the district is so tight, it barely includes the driveway, like they really narrowed the district down. It was a little bit bigger.
Could
How-
they, like,
however-
once they have one, could they propose another?
They could, it would require yet another vote, so that, you know, as Julie noted in her correspondence with us, you know, the word from the proponents was, well, this is, you know, a foot in the door. And
Right.
to me, that
Yes.
gave me a heart attack, and to them, they thought that was a good business strategy, which it is, it's an excellent business strategy, but, you know, not that we're not pro-business, we just don't like substances. So, you know, how we got the moratorium to begin with, and Catherine has some feedback, you know, has more details on this, was just to sort of, you know, talk about the pros and cons of marijuana. And I was in the room, the chief presented it. Catherine, do we have the chief's original PowerPoint? Did you do it?
I probably have it somewhere. But this was before any retail establishments had gone into place in Massachusetts. So we really didn't have knowledge on how the industry would kind of roll out. We had the promises from the CCC, as Julie noted, but we didn't know how things would be enforced. So obviously there are pros from some communities and some negative experiences from others, so.
Right.
And as it stands, Melrose has a place, the Stoneham?
Someone does not.
Melrose has one place.
They voted against their most recent.
Just recently?
Did the-
Well, last year,
Last
so.
year.
not
Did
last
the
year.
health department release any information prior to that warrant being going to town meeting?
Not that I'm aware of.
No.
I started probably right after that town. Stoneham joined us right after that, so.
Right, okay.
And it went to town meeting like it would here.
Yes.
Basically the same procedure.
And Melrose is a town.
No,
Right,
no,
city.
right, city council.
So do we know the history of, I mean, I'm not hearing any problems from Melrose, just,
Well, I mean, actually, Maureen, you were around for that one.
Yeah, I was.
The only thing I can contribute to that is, we know that the community impact fund that they've talked about, that is something that exists for a lot of communities that have dispensaries. Problem being, it's been clawed back, or there's litigation now related to those agreements, right? So different communities have either given money back, some have discontinued collecting money. The excise tax is something that's kept separate, so that's not
Right, it
the
doesn't come to
discussion,
us.
but the community impact
Right,
funds.
Right, so excess is, so Catherine, it'd be really helpful if we can, just have those talking points. And so one is, just sort of the history of what Wakefield has done. The next would be, the growing concern in the medical community about what we're seeing with cannabis. And I can attest to, a few articles, not but, one, daily use and cannabis use disorder is a thing. Cannabis-induced psychosis is a thing. Cyclical vomiting is a thing, like there are things here. It's not nothing.
Yeah, we have local ER data from Melrose, Wakefield, and Winchester as well,
Oh, great, okay.
with some information on youth intakes.
Okay.
The other thing too is the delivery. Would this include delivery ban, or would
Oh.
delivery be permitted?
It's not, it's.
You can get it delivered to your house?
It was
Yeah.
not specifically.
You can,
Wow.
in certain communities, they do deliver it to your house. But I don't
Right,
think-
so right now we have a ban on delivery, and so that would be something that I'm not sure, I didn't really see it.
See it either.
I wonder if Melrose does it.
Scott might have included in their notes, but that's something that is listed on the CCC, every community, whether they have a delivery ban or not. And right now we do, so.
So on this, so the other thing to look at is there is information actually, so the CCC is the Cannabis Commission. Is that the CCC?
Yeah.
Okay, they actually have a
Cannabis
website that's
Control
working.
Yeah, you do.
Oops. So, we have, 10 days. Well, I mean, it's probably not gonna be up on the first night, but tonight's the 17th. Town meeting opens on the 29th, right? It'll probably not hit till May 1st. So are we in agreement that we would like to represent ourselves as a board of health and health department with concerns about this? Or you want to stay out of
Well-
it? Let's start there.
My thing is that I wonder is Wake Up going to present something, Catherine, at town meeting? That's my understanding, you're going to present something about it, or you haven't decided?
I don't-
Wake Up's meeting is Tuesday.
Right. We haven't, usually before it was the chief took the lead. So we can, I mean, that has changed since we're not federally funded anymore. Up until October 1st, we couldn't take a stand on anything because of the federal funding with policies. So we'll have to check on that.
We don't know about police.
I mean, we're technically under the Board of Health and Health and Human Services, so.
Right, so I mean, I think for the purposes of town meeting, it should be a board, but the board gets its information from all the work that Wake Up does. So, we can say, as a board, informed by all the hard work that Wake Up has done over 11 years, we have concerns, and the concerns are the following.
Yeah, you can we can communicate the concerns, and then we can get some data from other communities, because there is some, I watched the board, the planning board meetings, and they did have some safety concerns about locations by schools and like the Odyssey Day School and School of Rock. And some of the thought is that if this is contained to this area, that doesn't open up a separate zoning district for downtown and things like that. So there are, where they were expressing some of those things. So that's something for the board to consider.
And the planning board, only voted to
let the town decide, you know, like what they would say. It's not.
Yeah. Yeah.
It's not a robust endorsement from what I understand.
But I can certainly put together all of the data points that the board requests and add to that in the wake up meeting, those concerns and questions in the wake up meeting and put something together.
All right, what do you think about the timeline? It's short. Catherine, do you think?
Yeah, I mean, we can put something together for sure.
Okay,
It'd be useful to add Stoneham's decision
yeah,
into the tab.
yeah, full
But
stop.
like-
Yeah, we can create a map where around us in the region in Middlesex County and Essex County where the bans are and where it's permitted. Like Anthony said, that 3%, what the negotiated municipal agreements look like and who's part of that. I think that's key too.
Does it matter that the one in Melrose is like on the highway, not really near where people live?
Oh, that's right.
It's harder to get to, yeah, Maureen.
Yeah.
Situation as to this.
They're gonna have the same argument with
Yeah.
where this one is.
But
except
people
that-
are living here.
But they are living here.
They,
yeah.
like, it's
Yeah.
right next to,
Yeah.
places where lots of
Same in-
people live.
Same where the one in Melrose is.
Is it near, there's homes there?
So there's a motel across the street that often houses people who are in vulnerable situations.
Okay.
So, if I could just make a suggestion that you can take or leave. Stoneham did go through this last year and had a big, battle at town meeting. And my memory is that they prevailed, the people who didn't want to have marijuana sold in Stoneham won by a very slim margin.
Yeah.
So they anticipate that the next round they'll probably lose.
Oh,
The cannabis industry has a lot of money.
Yeah.
They're gonna put more pressure and they're kind of admitting that they will probably lose next round. So what they did discuss, and Catherine, you might be able to reach out to Frank Gould, because Frank and Lois were very, very active. And so what they did discuss was guardrails, like, okay, if it's coming, what can we do to make it as safe as it could be? So one thing I would recommend based on Melrose experience is hours of operation. Things get a little dicey in the parking lot, after 10 o'clock at night. So I'd watch out for hours. When Melrose, I think we've relieved them of this requirement now, but when the one in Melrose first opened, we required them to be hardwired to the Melrose police station. So not just a phone call, they had to be, some hardwire. I don't really understand the
like an
technology
alarm
of
or
it, but
something, if there's a problem.
yeah. So, maybe ask Frank, what guardrails were they thinking about for the next time that they have to face this in town meeting in case they lose, so that they can have it be as safe as it could possibly be, given the reality of cannabis in Massachusetts.
Yeah, and having
Do
Chief
you-
Story talk to some of the other chiefs.
Yeah, Catherine, do you remember when it was the vote? You don't have any information there, how much of what it passed that we weren't gonna have it. Wasn't it a very large amount?
It was
again?
large.
It was really
I don't
huge, right?
think it came to account, to tell you
Yeah.
the truth, like when it's obvious, they don't count. They just say it passed, I mean, we can
Thought it was
certainly
a
look
big
at the town meeting, that Chief's thing. And interestingly, when it came to the state ballot question, Wakefield was less robust on the four, it still won, but, less robust because of the campaign. We spent a lot of time campaigning, we took months on that one. This one kind of caught us surprised as, and that actually will segue to something else I want to talk about tonight, but, so we're gonna try to put something together. Wake Up's meeting is next week. But I can certainly, sort of look at it with you, Catherine. I don't know that I can get to the Wake Up meeting, but if people there have any opinions, we could pull that together.
Yeah, I can pull it together before the wake up meeting and then kind of put together some of these things that you all requested, and then we can get feedback at the wake up meeting.
And, yeah. So we're in agreement that, we would like to just put, enter our concerns as a board. And I think in the way that town civics go, it's important that it be the board. The planning board is recommending. We could even say the Board of Health is not recommending favorable action on this for the following reasons. And so we have to figure out if the spokesperson will be on this, whether it be you, Catherine, or Anthony as the director. And we can hash that out next week and just see how it looks, or, you know, combine it. But I think that's our due diligence. We're not gonna just sit here. So,
Especially, I think, to bring it back up that, you know, we were against this from the beginning years
Yeah.
ago. So.
and we
you know,
remain again, we have not changed our
we're
mind.
not changing.
Have you seen our last vote? We're just getting very.
The names have changed, but it's still a no here.
Just to clarify, so, we're talking about having information being shared, which is good, I just wanna make sure. If the board does not, is the board going to vote tonight on making a statement, or is the board taking a vote on where they stand on this? I think
That's
just
a good point, so,
between now
so
and
we
then.
probably should, so we probably should agree that we're not, you know, that we recommend, that,
Not in favor.
that we, yeah, we are not in favor of this and do not recommend a favorable action. Can somebody put that
In a word,
in a
in a sentence.
The motion?
I have already forgot my vocabulary.
Make a motion that the Board of Health is not in favor,
Or does not recommend.
does not
Yeah.
recommend.
Does not recommend favorable action.
Sorry.
Does not, you're making a motion that the board does not recommend favorable
Favorable action.
action.
To the marijuana.
To the marijuana
overlay.
overlay.
I could certainly talk to Steve and Todd Holland on being recognized to do so. They may not recognize.
You may still have to make the motion second.
Yeah, so.
I screen the motion.
I'll
You want
second
to
I'll
that?
second that. All in favor?
Yeah, I so
For the line, thank you. Okay. Not. Oh. Julie, we're done with public participation. That's Leslie. Oh, Leslie, okay, hold on.
Yes, I'm sorry. I thought the meeting started at 7.
Oh, it's 6:30. So it's.
Could I be super brief?
No, I want to get through this. So, I think we understand I think we've heard. We understand.
There's new information I'd like to offer that you may not be aware of with another restaurant.
So in that case, we're not going to do that publicly. I want you to call the department with that issue, please, tomorrow.
Okay,
I don't want to hear a complaint at a public meeting.
okay. This has been another instance of word of mouth versus anything.
Okay, good enough. So so we're not going to do that in a public meeting, so.
Just so you know, the restaurant has closed, I believe, on its own.
Okay.
Okay.
So we'll take that after, you can call the office tomorrow.
Yeah, But you know how I feel about this information needing to be
retail.
public. Okay,
Yeah. Yes, we do.
okay. Thank you.
Thank you very much.
Yep, bye-bye. Hey, thank you for serving.
Thank you very much. Okay. So, a little bit of a segue. So we got through marijuana.
Communication.
Yes.
No idea.
So I had put kind of just discussion regarding communication amongst town boards. Amongst town boards in Wakefield, that's part one, and our other boards of health. So it's just a recommendation. It's just thoughts I've had. I meant to write you a brief thing.
Remember that pretty email tomorrow?
It's just not happening.
Please make sure
Yes,
that's
but
smiley
but if I become so inspired, I will, you know.
Please do
I
not
will-
become inspired.
Go get my doctorate or something, so no. So we're getting there. I just feel like I've been trying to be assertive, at least with members of town council, and that, you know, I just wanna endorse being active with checking with town manager, whoever is the chair, get in that office, just to say, you know, this is how we're going, and these are the concerns. And then town council, both chair and whoever town council chooses as representative to the Board of Health.
This will be a new person.
Yeah, there will be a new person. So that, you know, that's just my first, and just, you know, just to be mindful, so I actually did go through the Mass General laws regarding just essentially what boards do. And what is different about what we've done is that we have sort of taken chunks out of that, and especially in regards to, we have an opinion about the budget, but, you know, the town manages the budget, and really the town administrator, and then, you know, pretty much manages the budget, but we do have verbal oversight. We don't vote too much about that, so that's a little bit out, but I do want to let you know that Candace was at the FinCom meeting, and there was this sort of this general, the towns are spending too much money, kind of feeling, and we can absolutely defend, and they thought that we could absolutely defend our stance. And, you know, the big bump in the budget was because, the grant ended, exactly. And also, you know, we have all of these sort of post-pandemic recovery that, and just, oh, you know, the stock market's looking good, but housing is impossible for so many of our people. So we have this incredible need that Candace and I both, and Anthony both really, you know, demonstrated to FinCom. You know, like, we don't have a choice. We're gonna do this as a service, but I would just anticipate that, you know, next year.
Oh, I think
Get ready. And then I think we didn't really figure out with the tri-board how that was even gonna work. And I would just recommend that going, you know, in the future, that, you know, maybe the board just meet, you know, maybe the boards just meet with each other to kind of just brainstorm about the unique perspectives of board members. So, you know, for instance, I came in here very much on a substance prevention idea, because I figured, I don't know, you know, like, inspections run themselves because we have excellent staff. We were able, you know, when I came in here, nursing was paler, that it you know, was skinny in regards to coverage. We were doing a lot of sharing, now we're very robust. So those things have kind of taken care of themselves, but we had to get more creative on the social service side. And so, you know, I think it'd just be nice to hear from the other two boards as to, you know, what are they thinking? And then try to figure out, you know, amongst that, what, you know, then where is a priority? Getting back to working with Wakefield boards themselves, you know, town council has a retreat at the, I don't know when they do it, I think in the summer. But, you know, it might be that I would recommend to them, if they want to listen to me, that they invite at least a representative from every board in town, say, hey, you know, how are we gonna just do this better? I just feel like we have a little bit too much siloing. I don't know if that's reasonable, but it's my party idea to you.
Yeah.
You do with it what you please.
It's a
Do you have any
really-
thoughts?
It's a really reasonable idea, you
Yeah.
know, I feel like we're always trying to work together more, and you said it once, I thought it was really elegant, like, not about us without us, or like.
Yeah, the
basically,
t-shirt.
Yeah,
Yeah.
should be,
Yeah.
and there've been a couple times when I've kind of felt like, well, hold on, why aren't we part of this conversation more? Like, why, or why are we finding out at the last second this conversation's happening?
Yeah,
You know?
yeah. I think I start that every time I've talked to the town council chair. Said, okay, let's just start with just this. If you use anything that has to do with health or human services in a sentence, you had better tell the board.
Really, or at minimum,
Like, that's your test.
like email the department or
For
Anthony or
God's
somebody,
sakes,
you know, somebody, like,
Yeah.
It goes back to what I said about the training of your actual
Yes.
boards. If your
Yeah.
board isn't
Gotcha.
trained, they haven't gone to the training, no, the ICS training is never pushed in all these
No, I
communities.
know.
And if you don't push that for every single town employee to have
Yeah.
that, police and fire have to have it, schools, your
Yeah.
school nurses and that's where you learned your biggest thing. And the other thing is that a lot of people don't understand what we can and can't do. And I think that, I came from a health department that was different, that they knew. And when I was the interim, I remember doing those Friday morning Zoom meetings, and they'd look and I'd say, well, no, we can't do that. Everything comes down from DPH.
Mm.
The CDC says it's this way, but if DPH says, no, we don't want that, we have to do this, like something going on with them right now, what they're doing to us. No one understood that we couldn't do that, or we had to do that because that was the rule and we had to follow the rule. And a lot of it is that training, that Board of Health training, and I recommended, and I think Anthony, and I think it was in the notes, that when we do get up and running, because our other two boards, I think Stoneham has a new member.
A new member.
New member, Melrose is the same, and hopefully Wakefield will have a new member. And if
Oh, I
we
know.
don't, we'll
Oh,
have
that's
that,
right.
we'll have to see what we can do and invite somebody like Cheryl Savara to come in. And at that meeting, I believe that your town managers and your
Yeah.
mayors should be invited, your department heads, your police department, your fire department, your school superintendent, and let them come in and listen to her what the boards of health are supposed to be doing. And I think that may open up
Nice
a
idea.
little bit of
I
communication
might come.
as to, I'll invite
Sounds
you myself.
fun.
You can
Invite
be
me.
you can be my plus one for that. Because I found that was something, I did a program once, on something at City Hall, and I had to invite all of the department heads. And after the presentation, somebody said, oh my goodness, I never knew about this. This is wonderful. Whoever told you to do this? And they turned around and they said, oh, Mrs. Silver brought it. And they went, oh, why? I said, because I get this training every single
Yeah,
year and I
yeah.
want it here. And I think that may help to open it up.
Yeah.
And my other suggestion is, since I'll be sitting over there soon, is that with our tri boards, I think we should be meeting quarterly and keeping up, and which would be good. And if something comes up, I'm sure the chair of the board could notify Anthony, and Anthony could call us, and we could even do a quick talk or a quick little Zoom thing with the chairs if there's a big, huge
It's
problem.
true, so I mean, we haven't figured this out, but there is no, to me, I don't think there's an open meeting law conflict with tri-board having its own subcommittee, which is probably the chairs,
Mhm.
right? There should be no conflict
There
in
is no
that.
conflict. It's
No.
the
You know, so I think-
reorganization's-
Yeah, so I think that we can, I think that could be utilized more robustly. I feel like, all right. Any other thoughts? All right, I'll be watching. No, I won't.
She'll be the hand raised on the Zoom meetings, everyone.
So, not about us, about us. Oh, well, you're right. I didn't make that up. It's good though, to somebody else, but I think it's I think it's a very concise test.
Yeah.
Okay, so we are not prepared for a rehashing of food agenda. I just, what's going on, but Anthony, what would the process be to just look at various methods? So, I mean, we have for a long time, before the world of social media allowed information passed differently. And we've allowed restaurants to quietly clean up, address any issues, say it that way. And it seems like we have certainly have a public opinion shift. And we also have, I think in all things that are related
to all of us. We have, the same thing goes for the body, the body work stuff as well. There's this buzz that we may or may not hear about. Because there is just this algorithm in social media, whether you're gonna hear it or
Maybe
not.
the body work, like, almost like clinic.
Yeah,
It's not exactly what we have
Right.
in food service.
Right, well, yes, no, of course, but I'm just talking about communication in
Right.
general.
Yeah.
So if I just using the example of how the social media.
Sure.
Yeah.
Yeah.
So, and Cheryl Sabaro may have an opinion about this as well, in regards to, do we need a shift in operations? It's not a policy change. It's an operational change. I don't foresee.
And we don't share information right now to protect business, is that part of it?
So,
And
I think
just
right-
because we don't, and that's our policy?
Well, I
or-
think right now, we don't not share information. I think the way we've always done it has been, we've worked with the business, and when there is an issue, like there's been a few establishments, you guys remember, from the past that have had egregious issues. There are times when we'll need an emergency board meeting. This has always been, so far, the primary mode of communication for issues with restaurants.
Right.
Ones that cannot be resolved in a manner that's quick. There are restaurants that will have bad stretches, they may have a poor inspection. We may go back, and most of the time they've corrected those issues, right? And so I just want to be mindful of the restaurants and not. I think there's two parts of it, right? We want our businesses to do well, that also will contribute to the health of the community, right? And so I think before we move into a space where social media will only make it worse, right? It'll perpetuate and go, well, look at this, look at this. I also want to remind the board that inspections are but a snapshot in time, right? I mean, it is, we go in there, whether it's 2 times a year, 3 times a year, 4 times a year, we are seeing how they are doing at a moment in time, right? And so they could be having a great day and otherwise be maybe not ideal. Could be the opposite. They could be doing great most of the time. They could have one bad day where they may have a couple extra violations,
And
right?
that's when we show up.
That's when we happen to show up.
And there's
but-
something in the window, in the actual building, when there's like
A, B, and C.
something like that.
We
Yeah,
don't do
we
that.
don't do that.
We don't do
No.
that. So we don't have a food grading system, and there's a reason why there's no standardized food grading system, because an A in Boston is not an A in New York, and a B in Boston is not a B in New York or LA or San Francisco, whatever it might be. There's no great standardized grading measure, right? So a place could have a couple of issues that are more egregious than a place that might have a bunch of small things, right? Cracked tiles, window obscured, whatever it might be. They may have a bunch of small things that may contribute to a score that may not be representative of what they are. So we also don't want to run the risk of providing a false sense of security, right? We don't want to get to a position where we're saying, oh, this place is safe. People are like, oh, well, we can go there and eat and not expect anything, right? So I think we're always in that balance of sharing information. After hearing the discussion, I think what we can consider is when a place is closed, right? Whether that's because of a fire, because of violations, we could decide to have them, instead of posting a reason for being closed, we could have them, if they are closed by the Board of Health for sanitary reasons, we could say, look, you're gonna have to post it on your door, right? But I then hesitate to go, well, do we post it on the website? Should the town then post it on the Facebook, right? It becomes very slippery.
No, I get it, yeah.
So I think.
I wonder if the chamber would have thought about this.
The chamber most likely would. I think the chamber, we have an economic development arm of our town, I think, but not all establishments are part of the chamber, right?
Right.
So then it becomes,
Right, of course, yeah.
a membership issue, but I think overall, I think there's been some feelings about restaurants, and I think at the end of the day, you're taking an inherent risk when you're going to eat out. That's just the case. It doesn't matter if it's here, it doesn't matter if it's Melrose, it doesn't matter if it's Boston or anywhere else.
Right.
We could have the greatest inspectors in the world, which we have pretty great ones, but
Yeah.
it cannot guarantee that we are, all the restaurants are following all protocols at all times. So I think that's where we're trying to balance the action that we take.
I agree with Anthony, especially when we had grading systems. You'd open up a new restaurant on the corner and they get an A, and Bobby Charlie's little restaurant on the corner probably had an inspection and had problems. They had broken windows, their freezers weren't right, they had to be, and they ended up with a C. And then they go, well, he got an A, why did I get a C? So he wants to get a B or an A, because he wants to be like his neighbor 3 doors down. So they have the right to appeal, and when they appeal, it's only a 30-day window for an inspector to have to go back out there. And then he may not get that A, he's gonna get a B, and then he's mad, because you're gonna say, I ain't going there, it's a B, I'm only gonna go to the A. But the A could have flubbed up on something and took
Huge that
something,
night,
and
yeah.
that night, and there you go, you got
I think you
Vibrio
make a good point, that
salmonella.
it is a snapshot.
Yeah,
It
And-
is.
And I think that's
Yeah.
why it's important to remind people that we go more than once a year,
Yeah.
you know, especially now that we're fully able to do that.
Yes, yeah, we, like, I mean, you all know, I mean, you've heard me talk about the FDA
Yeah.
scale, the risk
Yeah,
scale.
yeah.
So we, based on the risk of the restaurant, we
You
go
never know.
up to 4 times a year. That's not counting re-inspections, right? That's 4 standard inspections and then re-inspections as needed. So we're there more than 4 times a year from these places.
And let's face it, sometimes you may have an outbreak. I had one time that came and it was centralized. Finally, they identified the place, and when we walked in, I'm going to myself, I can't see it.
Yeah.
I can't see it. It took us
No.
probably an hour of watching daily operations and then went, oh my God, look at this. You know,
CPH had to swab like
Yeah.
a tiny piece that we found.
Oh, yeah, remember that one too? We had
Years
that, yeah,
ago, and
years
it was
ago,
like,
yeah.
wow, like,
Mhm.
no one would have seen this.
And even DPH, they came in and they thought we were crazy when we said what we thought was the violation, what happened, how this
Yeah.
happened, and they said, there's no way, and they came in with, oh, yeah, you're right, you
Yeah.
know?
Yeah,
And that's what it is, and it's, when you put that sign on, I always say, and I said it to Anthony, that sign goes on, closed per order of the Board of Health. Then people say, you know what, they may never go back there, or they may, but at least to me, I know that something has come out and it's gonna be corrected, and that mistake may never, ever happen again.
Or it could be just a fire, right,
Yeah,
which has
could
nothing
be,
to do
yeah,
with
right,
any sort of
right.
like service related.
Suppression system or the
Yeah.
two-bay sink or the mop sink ain't right,
Like,
you
it
know?
throws it back.
Yeah,
You know,
right, yeah.
Smoke condition from a
Yeah.
fire, we just had
Like,
one.
you know,
yeah.
you know,
So
so,
the
yeah.
restaurant's affected.
It's very hard, it's hard.
so I guess it would just might be prudent, I love that,
Sounds good.
just to have a bullet explanation of, this is how we do things. We are using an upgraded code. Any inspection is, as you said, a snapshot in time. We have utmost confidence in our inspectors, and our restaurateurs have been cooperative, and if not, further action is taken. I feel like that just gets ahead of it.
Yeah.
I'm sure you can do it better.
And I wonder, is there more buzz now because we actually have enough staff to do these inspections? Where at least like the first couple of years I was on the board, we just weren't able, we
Yeah.
didn't have
Yeah.
that person.
We
And
also, we also
were
hadn't,
sharing.
we hadn't done the FDA regs.
Right,
either.
Yeah,
and
we
we were
hadn't done
basically
those
just
either,
like
yeah.
scraping by, and so now we have the capability to do this, and we are doing this, so stuff's gonna come up, we're gonna find stuff.
I think we're following more the FDA rules when they changed. That really brought them more up in light. That gave us more opportunity and the right to go in and inspect those really dangerous places more often, and gave us more time to go in and, like they said, work. Because working with the owners, I think, helps, and it helps to prevent in their education.
I think people might be feeling anxious because we're not going to restaurants as much, even restaurants where you would typically get takeout. Since the pandemic, the takeout game has like gone up to the next level, right? So you can get takeout for places you would never get takeout.
Yeah.
Where before people would go into a restaurant and have feeling that, this is, or they would go to pick up their takeout and be like, I don't know.
Yeah.
But now it's just being brought to your home, which is lovely, and I
Yeah.
utilize that service often. So I will own that, but I think maybe there's more of a worry because you don't know, you
Yeah.
can't put your eyes on where your food's being prepared.
Transportation.
Yeah.
Yes, absolutely. Yeah, and I will say, I think the big thing is, again, it's a snapshot in time, but the restaurants that are open, they're open because they're safe. Right, so as soon as we've made a determination that a restaurant is not safe to eat at, that place is not gonna stay open.
Right,
Right.
it's not,
So, I'm happy to clarify with signage, if there is a closure in the future, we can talk about posting a sign that actually says it's closed, I think that, if that's helpful, but.
Well, I mean, again, though, I'd like to hear from different community, you know, I kind of like the coalition of the public health, you know, like, I would like our neighbors to, or all of us to sort of look at this, right, you know? It could definitely be someone's research project, but, you know, does this, you know, how does this impact? And what, you know, and bottom line is, what keeps your community safer? So what keeps your community safer is always doing the inspections. Does that, you know, does different wording or, you know, more public posting, you know,
For the public education also on the fact that, as it was stated here, if someone goes into a restaurant where they see or they have something and they're very, very concerned, I've done it myself, and I've seen something, I go on that website to that city or town and I put a complaint in myself. I saw it happen, what was I gonna do? I'm gonna try, and I think a lot of people don't know how to do it, you know, and I think they have to be educated that it's okay to do that and send an email or call and let the department know that you suspect something. And our inspectors are very good, and they'll go out and they'll stop in and see something if they see it right away. And that sometimes is the best way for us to find something, I think. That's my opinion.
As recent as this last week, we received a complaint, you know, concerns about a restaurant and their safety and their practices, and we went out and we did an inspection. We didn't find all the things that were being said, but that's part of our job, so, yeah. Again, we
The
encourage-
process worked.
Yes, we
Yeah.
encourage people to reach out. I mean,
Yeah.
they seem to be pretty good at finding us. But again, we can put it out there more and just say, this is how to reach us.
Maybe we could have our inspectors do not a TikTok, but a little video. You know me, I love those.
Wait, you're up to date. I think I've
Right?
fallen behind.
Yeah. We used to do them from our health department every year for the mosquitoes and the suns, and our local TV station used to
They have
film us.
TikTok
And we
Do
used
we
to
have-
play, it wasn't TikTok, it was local TV.
do we have any interns coming? Oh my God,
Yeah.
that's a great
We-
idea.
We do, we have two interns starting with the from the Department of Public Health. One's from BU, one's from Harvard. They're starting sometime this summer.
Ask them to review.
It's a really good
I
one.
think this is a good project.
And WCAT is very good to work with,
Yeah,
and that's
yeah.
what we did, our local community, and they used to play them all the time. They would walk down the street, people say to me, oh, I know you, you're the mosquito lady.
I saw mosquitoes the other day. Wow, okay. Any other thoughts on this topic? Okay, so I feel duly covered. Oh God, I'm gonna stop talking, right, in 2 minutes. So the one thing that I didn't put on the agenda, but I'm gonna wrap it into gratitude from the outgoing chair, is that I'd be happy for you guys to be organized. So nobody calls me.
Yeah, nobody calls.
So that's up to you. We can do that at the end. But I do just, you know, wow, what a time we've had, right?
Yeah.
2 pandemics,
All changes.
incredible policies,
Mhm.
incredible growth. So proud of, you know, everything that we've been able to achieve with really impressive grant writing and really becoming competitive. Like, we are the bee's knees. Sure, we'll continue. So, like, you know, all of, please, you know, my regards to the whole department. It's been a joy. I'm so proud of all the work that everybody does. It's pretty cool. And, you know, there have been times where I benefited from the expertise of people in the department, so it's kind of, it makes it personal. And today I gave someone an interface referral because, you know, the waiting list was too long for something. I was like, oh, wait a minute, where do you live? Let me change my hat. So it, you know, it really has been something. So appreciate all of you. And I'm sure, maybe they'll see, you know, which it's kind of the best of both worlds. I got to finish my term, and we're not slogging someone through a public campaign, and so hopefully, you know, as we have.
No, they have to do a public campaign, come on. You got those signs everywhere in your house still.
Yeah, I do.
In my basement.
They're gonna get rid of them. Yeah, I mean, it's really a unique and generally science-driven You know, like well, you know, I mean, I just think we have so much science behind us, right? And, you know, and every other board, there's not as much evidence-based practice by, you know, by just the basis of that. You know, so I realize that I could be on no other board because I can't stand, not feeling sure about my decision. Just can't tolerate it, and I think this is as far as I'm gonna go.
I can't do math without a calculator.
And that's, thank you.
Sure you don't want to stay.
I'm good.
I mean, we'll keep your seat.
Yeah. I'll bring you water, coffee, whatever.
You don't have to be chair.
Yeah.
Right.
You can just be the secretary, how's that?
I'm really excited to see, you know, a fresh perspective, I think. I no longer feel so fresh, so, yeah, we'll go from there. Health director's report?
Yes, we don't have a printed one, but we don't have much going on in terms of new updates. We just since the last meeting, we have been working on camps. Sandy has been working very hard on camps because we're getting started. We've met with that. She's met with all
I
of them.
have Sandy's update right here.
Great. Yes, please do, Melissa.
Okay, so DPH has updated their guidance on COVID and it is posted on mass.gov. It's just another respiratory virus now. Sandy was,
Like how?
Yeah.
Still
We've
like,
done-
yeah,
I mean, it's only been a couple of years.
Yeah.
No.
Since like ICU and,
Yes.
you know, and now we're like, it's cool, it's nothing to work with.
I gave a couple of COVID tests out to a guy who said that he almost died and was in the ICU. And so he always tests when he goes away, when he comes back. So that was just today. But so Sandy's been working with Jen to get the website updated with the new information.
Shout out to Jen, yeah. That's a
Yes,
different-
she's fantastic. Across all the towns, she's really a gem. Sandy did a tick and mosquito article for the senior center because it's been mild this year and ticks never really went away. As well as Sandy and I did an article for the eclipse, total eclipse, to protect people.
Don't go.
And we ordered flu vaccine for next year today. The state updated their camp regulations and there are a couple of major changes. They've expanded the care or the discussion around diabetes and inhalers.
Oh.
And then there's some other things that are going on, but they really have sort of built out their information that they want the camps to come back with strong policies and procedures and, you know, have
Things like don't lock up the EpiPens.
Yes, exactly. And so they're sort of putting the departments of public health in the middle and saying, look, you know, you guys have to get the word out there and we're gonna be checking on you to make sure that you are getting information from the camps. So Sandy has met with several camps already, including the Boys and Girls Club, which used to give us all the runaround. So, let's see. Oh, she's working with Tom Walsh and they're planning for Narcan boxes to go under the AEDs in all the town buildings.
Wonderful.
And Narcan
Brilliant.
training for city employees and library, DPW, you know, places where you might run across somebody who's, you know, where you might need to be able to administer it. So they're working on that. In terms of Maven, there was a pertussis case with a 13-year-old and a measles case in a 13-month-old. Who just got their first measles vaccine at 12 months. So
That's weird.
Yeah,
Yeah, I read that.
Well, the resource
Interesting
is
case.
coming back.
Yeah.
Yeah, it's coming back.
Oh, yeah.
It's coming.
Thank you.
and I also read in the public health report that the Northeast is getting more dengue fever. Because it is coming from Latin America. People are traveling on vacation and,
No, it's
And-
us, we're visiting.
Yeah.
Yeah.
so Sandy got a dengue fever and the person also came back positive for Zika.
Oh, double whammy.
That's a
Yes,
throwback.
Double, yeah, right.
she had been in Brazil,
Wow.
so.
Not pregnant, please don't.
So Sandy's been really busy and so we have a great public health nurse.
That's awesome.
Yeah.
That's awesome. Yeah. Oh, wow. Nice. Wow. Not cool, that's, I mean, but that's, you know, that's what we, thank you for. Can you? Is it, if it's a written thing, we just hold it into the minutes?
Yes, you will.
Someday if you guys ever wanna save yourself a meeting, send it, just write it. Becomes how we record it, read it, but it's always nice to hear it.
Yeah, it just was Sandy wasn't in and so I
Yeah,
couldn't get it, but
Yeah, no.
if you wanna come to the
Camps?
Melrose meeting tomorrow, you can hear my report.
No, as a region, you know, not a bad idea to just remind, oh, I know, my question is, how do I get colors, stop emailing me? Can I just unsubscribe?
Oh, do you wanna take the new training?
so
every
done.
week?
No, aren't you gonna
And both, my,
Aren't you gonna volunteer for clinics next
Yeah,
year?
you could be a real, you could just be right
I
there.
just wanna make a clean break, we can sign me up later. if we're still using it, but They're,
Unsubscribe.
Yeah, just
yeah, there must be.
Unsubscribe.
No, I know, it's like figure.
No, it doesn't with color.
Unsubscribe from everything.
I'm not
Yeah.
Mark it all as junk.
Yeah.
Go straight to
Spam.
junk box.
Cindy, don't put her in any clinics for color.
Okay. We can see if we can get you off there.
Yeah,
I think the
there
only,
is something you can do, I forget what it is.
the only thing I can remember now is that, since the Wakefield board voted for nicotine-free generation, an article came out on action on smoking health, is that right, Ash? Nationally, I don't know if you guys saw the article, but Stoneham and Wakefield were named as the first two communities, well, first two boards of health to pass nicotine-free generation in the state of Massachusetts. Other communities have now looked at that and said, well, why not us? So tomorrow night is a big meeting for Melrose. There's going to be, the board is going to be having a similar deliberation as the board did last time. We have a couple other communities coming up very soon, Malden, right? Chester.
I did tell. I know I emailed you or texted you that Jason Lewis called me on Good Friday.
Yeah.
Yeah, you did, yeah.
So
Yeah.
that was interesting.
He's behind it.
And Britain is now going countrywide for smoke-free generation. They already put the date in.
I think they did.
Yeah, they did. I forget what it
I
is,
don't
but
know
it's
what
way
date it is,
before us. Yeah.
2009, I think would be their effective date.
2009?
Yeah.
Yeah, and I think it still needs to be voted on,
Yeah.
but
That's the
but
proposal.
They're gonna go
the
country.
incumbent administration wants it. They'll get pushback from the conservatives, but yeah, no, I hear almost every day of some other community that is Chelsea,
Yeah,
Somerville, Cambridge, Worcester,
yeah, Worcester is,
some bigger communities, Saugus, Beverly, yeah, I can't even remember.
they're all coming. They're all very inquisitive in our local chapter of public health nurses. Will Maureen will probably be our guest speaker in September because all of them now are having their townwide meetings about it.
Mhm.
And as Melissa and I sat there and said, oh, we already passed that. Yeah, we did that.
Yeah.
What else you got going?
Yeah, we're like, what else? Do you need something else?
So that was the last item, but I just wanted to say, after our FinCom meeting, Laurel and I took a stroll down memory lane. I got to hear a lot of stories. I got to watch a very interesting meeting from years past, but I just want to say, you know, it's in the steel line from somebody else, but it's hard to say that you're always a difference maker. The 15 years you've made a difference. It's in a variety of areas. The changes, the policies and everything that you've contributed will stay. And that's really important for people to remember, that you did make a difference in Wakefield. The community, I'm sure thanks you for.
We all need it. Thank you.
Everybody gets a
You guys are-
I think, I believe it's in the town charter, you
It
can't
is
do it.
not
It
in the
is.
town
We
charter.
never reorganized till after the election,
Because
it was somebody running.
there was nobody.
Did we reorganize last time? I don't know. We
The-
can
the
reorganize, if
person
you
whose
wanna
term
make it
ends
happy, I
next
don't
week
know.
shouldn't be the
But then we're
chair.
gonna have an empty spot, so it's not completely
We
reorganized.
can reorganize again.
We're gonna lose
Again and again and
secretary spot.
And we will be able to still
Or
have.
I can defer to the vice chair until Tuesday, but it just is.
Oh, yeah, you can do that, you could be the secretary
No,
until Tuesday.
I'm not.
Well, that all but closed the door.
Be the secretary, you don't have to worry, 'cause Cindy has all the
She does
notes.
such a good job.
Yeah, you don't have to worry.
It's up to you guys, just refer to me.
Would you like us to reorganize tonight, and then that way you'll be all set?
You'll be the chair.
That's a decision the board gets to make.
That's up to you guys.
All right, Candace, what do we do? We just go and get it over with?
I mean, I guess I'm kind of a fan of fighting the bullet. But I don't know if it really feels like for me, it makes a huge difference.
It makes a difference for me.
I don't want anyone to
Makes a
call me.
difference for her, because she wants to ask.
I get that, 100%, yeah, so
So-
maybe we can
so-
save you some aggravation.
Yeah.
Do it. Yeah, let's just do it then,
Yeah,
yeah.
you know, so I can just tell Steve Mayo, not the chair, call
Take
call
get
whoever.
rid of my email. Take me off.
Too, I
Erase
actually,
me
me
from the
off of
letterhead.
I
that.
have to figure that out, yeah.
That's very easy,
Yeah,
one call.
I think they kick you off of email pretty fast.
Yes, they do.
Yeah, we do.
So next Tuesday, so I have to organize
Yeah,
that stuff.
yeah, make sure you have.
So the
it.
town has evidence of everything I've said, but I will no longer have evidence of everything I said.
You can make a public records request, we're really good at those.
Yeah. They work.
I'm good with that, because I don't wanna download anything. So I'll know, I'll know, well, it's funny because somehow on my account, you guys did it, like I accidentally, and someone just did this to me, where you accidentally reactivate an old meeting and all of a sudden, like this email goes out, and it was during COVID.
Yes.
It went to Ruth and it went to some of those fast things, and I'm like, what the hell is it, you know, and there's like, these people aren't, I'm like, what just happened to my phone? So.
My turn. I know it can't.
That's a funny.
There you
Is that
go,
okay with you?
Candace, you don't have to worry.
Thanks for not making me say it.
I know it was coming, I know it was coming, I know it was coming. So I knew it's my turn, because next year, my term's up.
Oh, you're not,
We'll see what happens.
Yeah, we'll see, I know, well, you have the record,
Huh?
you'll have the record.
I will, yeah, that's right, I'll have the record now, being the longest on the board, yeah.
Pretty big.
Yeah,
I gave it
yeah.
up, I know,
No, I
it's
thought
hard.
that,
Well, maybe prior.
yeah, one of them, well, they may not be as long as us, because we ran that year.
We're in,
Oh,
So
I'll
do you
gladly
want to
accept it,
nominate?
but
We need- we
what
need
do we
a,
have to do?
You can make a motion.
we need a motion to reorganize.
All right, so I'll make a motion to reorganize.
I'll second that.
All in favor?
Linehan, aye.
Silver,
Okay.
And then I
so-
make a I nominate, do I
Yeah.
nominate?
You can nominate.
Sure.
I nominate Mrs. Elaine Silva to be our chair.
You
Elaine,
can
you have to
second that.
I'll second that,
Alright.
all in favor,
Well, and then when does she?
Well, Elaine has to accept.
as
Oh,
of,
I'll accept.
as of
As of tonight, what
Tonight.
time is it? As of tonight, April
midnight.
17th.
Seven
17th, right?
40 in
Alright, so
the
that's
evening.
24. And then, I will have to, are you coaching, are you?
Yeah, she's vice chair.
Are you vice chair?
I'm
still?
secretary right now.
Secretary.
So make her
No, she
vice
has to
chair.
come out.
Make her
Of
vice chair.
secretary, and I'll
So-
nominate, Candace Linehan for the vice chair.
I'll accept that.
That's great. Any argument?
I second that, and all in favor,
Silver eye,
Orville, aye.
there you go.
Okay, it's
The
official.
position of the secretary
Is
will be
vacant.
vacant.
Yes.
So if there's anybody out there
And we still don't, we haven't heard?
We'll hear after election.
Well, there's write-ins
Yeah,
There's, well, that's right, that's
I
right.
haven't heard of anybody
and,
mounting that kind of.
no, it's, when is your next meeting?
Next meeting will be on May, where's the calendar? I do
I have
calendar.
it.
Let's call
I
it
don't want to look
15th.
at calendars.
It's-
That'd be the
What?
3rd, right?
No, that would be the time for your tri-board, so, we need to think about getting that on maybe for June. So the 15th is the third Wednesday in May.
I also have the next two board meetings coming up tomorrow and next week. We could
Okay.
ask if you guys would like to do a tri-board meeting in May, we could, I could ask them.
We could, we wouldn't have our, we possibly still may be undermined, you know, with no secretary, but maybe we should do it where they have two new people and just try
Oh,
to
no, this
get
is a
to
good
know
point.
everybody.
It would be good to have
have it
a
up,
new
yeah.
member be there for tri-board.
Yeah, I mean, do we wait or?
We
you know,
could, we could
don't
always
know.
wait too. That's-
We can wait. I think you should explain to them that we really truly want one and why don't we book it for, is it June? When would it be in June?
Does the board usually skip summer meetings?
Yes, July and August if there's.
Oh, July and
nothing.
August, sorry, July and
But-
August.
I have to say,
Juneteenth
I
would be
feel like-
our 3rd.
Yeah.
And we often skip
often
December,
do.
and I
We
just
always
feel
do.
like lately there's always been something.
Yeah,
We're not really getting away with it anymore.
yeah.
So it's up to you guys.
And that would depend too on when we got somebody new. Because if there is
Yeah, that's a good
nobody,
point.
then
Bring
they'll
someone new
open
in.
it up, usually the town administrator, if I'm
Yeah,
not mistaken, the
that's
town
the post.
council, will open it up.
And
And
we'll
it'll
have
be,
to-
it'll be
So
posted.
they'll have to post, it's like a
Yeah,
job basically, they'll
yeah, and
apply.
Elaine and I will.
Yeah, we'll interview
Yeah,
with them.
right.
I mean, you're looking at, you may not have somebody till September.
It could
Because
happen,
May, June, you know, July,
but you'll still have four.
yeah, it's still us, the two of us, we're good.
Good looking.
Yeah. We know what we're doing, I think.
All right.
All
So May
I know
15th, then
history.
we'll say our.
Just a regular board. meeting.
So do a regular board meeting
Yeah,
on
maybe we'll have
Wednesday,
somebody.
May 15th.
May 15th,
Yeah,
6:30.
Okay, 6:30 here.
Yep.
This room's nice.
6:30 on Zoom.
Thanks.
Okay, we need a motion.
Is there anything
Oh,
else?
because you're the chair now.
Is
Yeah.
there any?
So I'll make a motion.
Oh, wait a minute.
What?
Oh, yeah, that's right. I
So
said
you're
till
the
midnight,
chair.
right?
Oh, you said midnight.
Midnight,
Oh,
right?
all right, so you make the motion.
I'll make a motion to close the meeting.
I'll second. All in favor?
I saw it. So we're closing at 7:43.
Not bad,
Yeah.
not bad.